started your timer and here is your question. Right, so if you have read and understood, considering it clinical examination station, kindly begin.
Okay, I'll enter. I'll wash my hands. Um, Good morning. I'm Dr. Olu, one of the surgical doctors here. Can I confirm your name and age, please?
I'm Karin, 55 years old.
Okay, Karen. This morning, I want to examine both of your needs. It will involve me looking, feeling, and moving them, and also doing some tests. Hope it's okay by you.
Yes,
Okay. So kindly off your shoe.
yes,
Then I will expose. You need to pull. Only put. Remove your gown. Only put on your pint or your shorts on while we do the exam. Can you
okay,
please walk this distance towards the door and walk back?
okay.
Okay. All right. Fine. Hope you are not. Hope no pain now. You are not having any pain.
It does, but I can tolerate.
All right. Can I? Do you want analgesic so I can continue?
No, that's all right. Continue, please.
So I want to look. I want to look at your knee now. So I'll bend down. Look at both knees in front. I also look at the sides, both right side and left side. Then also, Glenn, I want to look at your knee. I want to examine it from the back. Hope it's okay with you.
Yes,
So I'll go to the back and then also examine the knee for any swelling, scars, and the abnormality or any deformity in the knee. Okay, thank you. Can you please lie down for me?
yes,
Okay, so I want to touch your knee now. Apart from, I'll start with the left, then I'll also touch the right knee. So I'll check for differential warmth. Then I'll also on both sides, and then I'll check for tenderness. So to check for tenderness, I'll start from the tibia chin, come to the tibia tubercle, then up towards the patella tendon, then round the patella, then up towards the quadriceps tendon. Then I will also check on both sides at the joint line, laterally and medially. Then I also palpate I also want to check your back, the back of your knee to see if there is any swelling there or if it's painful. So I'll also check that. Then I'll check and then I want to bend your knee, Klein. I want to check the vessel at the back of your knee. So I'll check both vessels. So thank you. Then now I want to do some tests for you. Can you kindly bend your knee, Klein? So after bending the knee, I will check for if there is posterior sagging. I want to see if your knee is sagging. I'll compare both sides together. Then I want to assess your ligaments, Klein. So I'll give it a little pull. If you have pain, kindly let me know why I do that. So I'll pull towards me to do the anterior and then pull back towards to do the posterior cruciate ligaments. Okay. So Glenn, I will now do I will also do another test to check the ligaments of the knee. So I will do the Lachman test, bend the knee to about 30 degrees and then pull up the leg while stabilizing at your thigh. Hope it's okay. So hope no pain. While checking this, I'll see if there's any pain or for the pain. Then after this, so now I want to check your ligament on both sides on the outer part of your knee. So I will put the leg straight and then put a stretch, varus and vagus stress test on the knee to see if the ligaments are damaged. Then after that, I will also bend your knee a little bit and also check. Then after that, I will assess for the meniscal sign for meniscal injury, checking both the medial and the lateral menisci using a McMurray test. Then after that, I will measure your knee. I forgot. So I'll measure the circumference of your thigh on both sides and then compare. Then I will check that there is the vessel below. Then to complete the examination, I want to examine the joint above and the joint below.
Okay.
Then I also want to check your hands. So I will look at the hands, the fingers to check for any deformity, any swelling, also in any joints that is also swollen because of the rheumatoid arthritis that she has. Then any deformity in her fingers, like trans neck deformity. Then if there is also abiding nodules, that I will check. Then because of the diabetics, I will try to check for the nerves and distal sensation, then distal sensation in the nerve. Then the other thing I will do now is now to move the knee. So kindly, can you move your knee, straight it, bend it to the extent that you can. So after that, then I will move the knee myself to do the passive movement of the knee.
Okay. Are you going to examine just one knee or the both knees?
No, I'm doing both knees together. I was mentioning.
You have to, yes. Tell me
the-
so that I know you're examining the both sides.
If
you are given the choice, which knee would you examine the first?
Yes, I will examine the left first because that one is not causing that much pain.
Okay.
Then now go to the right now.
Okay. So you've carried out all the examination on both the knees.
Yes, ma'am.
8 seconds are left. And then if you want, you can summarize your examination.
Okay, I've examined a 55-year-old client, a obese woman who has bilateral tenderness on both knees, no knee deformity. There is swelling on both knees.
Yes.
And the range of motion is limited actively, but passively I was able to do a full range of motion. There's tenderness.
Comment on the gait. How was the gait? How was the ligament?
Yes,
movements was possible or not? Which special test was negative?
She has a Taji gait more on the right limb, and then on the right limb, the anterior cruciate ligament is the anterior drawer test is positive, and the valgus stress test on the right is also positive.
All right. So what are your differential diagnoses?
My differential diagnosis in this woman includes rheumatoid arthritis of both knees.
All right. Yes.
And osteoarthritis of the knees also.
Right. What investigations would you carry out to confirm your diagnosis?
I want to do a plain radiograph of the knee with the patient with bearing. Then also I can do an MRI scan of the knee. Then the rheumatoid factor assay.
What would you look for in MRI scan?
For the MRI scan, I'll be interested in the status of the ligament, the cruciate and the collateral ligament, and also the menisci.
So. All right. Okay. What management can you offer this patient?
Yes, the management, the pain relieving medications, control the rheumatoid arthritis that he has with medication, and then arthroplasty, which can either be a total or a partial total or partial knee arthroplasty. The patient can also benefit from a realignment and osteotomy also. Okay,
you asked for weight-bearing X-ray. In which condition you do not recommend weight-bearing X-ray, or when you have to take caution not to do the weight-bearing X-ray?
Okay, where I want to do a weight bearing X-ray is immediately following trauma. I want to do a weight bearing X-ray because patient may not be able to stand up and bear weights and take the radiograph at that time.
Okay, but in which condition would you not recommend weight-bearing X-ray? When weight-bearing X-ray is asked for, if I ask you this way.
Okay, conditions where I want to do a weight bearing X-ray is when I'm thinking of osteoarthritis of the knee. And
Yes.
that the patient will bear weight and will be able to see the features of osteoarthritis better.
All right. So what are the features of osteoarthritis that you'll find or you'll see on X-ray?
Okay, ma'am.
See?
There will be loss of the joint space. There will
Yes.
be presence of marginal osteophytes,
Yes.
subchondral sclerosis, and subchondral cyst formation in the adjoining bones.
Very good. Okay. What is the surgical management of osteoarthritis? Quickly, if you can tell me.
The surgical management of osteoarthritis includes doing a realignment osteotomy if it's affecting just only one aspect of the one compartment of the knee. Then also a possible of partial knee arthroplasty or a total knee arthroplasty.
Good. Thank you.